So many inquiries about breakouts on the face. Now, not all breakouts are the same, and dermatology is a very visual field. So it really depends on where your breakouts are and what they look like. We look for patterns and the way the breakouts are situated on the skin. So it could be acne, it could be rosacea, it could be perioral dermatitis, it could be folliculitis due to yeast, so many different reasons. So let's start with acne because that seems to be the most common. You could have hormonal acne, which typically is right along the jawline. Your hormones might be perfectly fine, but it's your hormonal climate that affects the skin. So I love birth control pills or a medication called spironolactone for this. Guys, sometimes it takes 3 months for hormonal acne to show up. Like if it's from a hormone treatment you're doing, and it takes 3 months for it to go away. Sometimes it's related to pregnancy, sometimes it's from IUDs that secrete progesterone like Mirena, but you may not see it for a few months and it may not go away with treatment for a few months, so be patient. Next up, comedonal acne, which is whiteheads and blackheads. Whiteheads are closed, you can't see inside. Blackheads, they are open, so you can see the little black dots in the pores. They typically happen in your T-zone, so glabella, nose, chin area, and sometimes the medial cheeks. So those respond really well to Retin-A and Tazorac, which is even stronger and better than Retin-A, and then ultimately Accutane if they don't go away. That's how acne actually starts. The very first sign, great in-office treatment, is the Diamond Glow that does a little microdermabrasion, sucks out all the debris from the pores using a vacuum, and infuses the skin, almost flushes out the pores. It's awesome for comedonal acne. Okay, so let's talk about perioral dermatitis, because this looks a lot like acne, but it's not, but we treat it very similar to it. You get little bumps, particularly around the nose and around the mouth. Sometimes you can get those bumps around the eyes. So with that, you really need an oral antibiotic and special prescription washes and topicals. If you have something like this, call my office. We do photo consults. You can swipe up here for that. Folliculitis. This is basically acne on the body. If you love wearing yoga pants, like I do, and you're sitting at your desk or sitting down for long periods of time, you may be experiencing this on the thighs, buttock, on the back. This is something that can be treated with an exfoliating spray or toner with glycolic or salicylic acid. Laser hair removal works really well for this as an in-office treatment. Sometimes we do oral antibiotics, but you really need to exfoliate, wear looser clothing, and don't put friction and pressure in the same areas that you're breaking out. And make sure you clean the skin after and before you work out. So sometimes it's sweat related. Rosacea is not acne, but can look like acne pimples. There are no whiteheads or blackheads in patients with rosacea, but what you see are red pimples on the nose and the cheeks. You may also notice it on the chin. With a rosacea flare, sometimes it can affect the inside lid as well, so you may need oral antibiotics, and certain topical prescriptions work really well with this. Sulfas, they called Metrogel, azelaic acid. Those are some ingredients to look for. You can also do in-office treatments with the V-beam laser or the IPL BBL series, works very well. Okay, I think I have totally talked your head off, but drop me some questions. I gotta go do homework with my daughter right now, but I'd love to answer some more breakout related questions later tomorrow.